had a little bit of a fever and, chills and kind of some, pain in my arm where I got in the injection. But those side effects were short lived, less than 12 hours, easily managed with, you know, Tylenol or ibuprofen. And compared to contracting COVID, the side effects were really nothing.
That was Representative Steve Eliason back in November, talking about the effects of the vaccine while he was taking part in a clinical trial. Welcome to our In Focus discussion tonight on the latest on the COVID vaccines. We start with a conversation with Representative Steve Eliason earlier today, who you just heard from. He is a Republican state legislator who represents the city of Sandy. Here's why he decided to take part in the vaccine trials and how it actually benefited his family later down the line.
Representative Eliason, thank you for making time to join our conversation tonight. I'd like to start our discussion with the Phase 3 clinical trial study. How did you find out about it initially?
Well, I work in healthcare, and I heard a physician at the hospital I work for mention that there was going to be a trial going on in the Salt Lake area. So I just got on the CDC website and found out the clinic that was doing it and cold called them and got my name on the waiting list, and then was lucky enough to get selected.
There's a number of people who are skeptical to get the vaccine, let alone to participate in the trial. What made you want to get involved in its testing phase?
Yeah, I'd never done a clinical trial before, and there was some apprehension, but from my position in the legislature, just being a father and citizen, I saw what a tremendous impact that COVID had been taking on society, and so I thought maybe I can be part of the solution here in terms of helping with the vaccine approval. And there was also a component where I thought if this vaccine works and I get the real thing, not the placebo, if some of my family gets sick, then I'll be able to help take care of them without having to worry about contracting the virus myself.
And that actually happened. You were telling me that your fear actually came true, and it actually paid off that you participated in the trial and had this preparation done. Tell me about that.
It did. So just less than 2 weeks ago, a number of my immediate family members had a positive COVID diagnosis, a variety of symptoms. But I was able to, take care of my family for the necessary quarantine period and kind of course of the disease. And I didn't have to worry about, I wasn't concerned about contracting the virus. And my first day back in person at the legislature, I did a rapid COVID test and it was negative. So I have, positive proof that the vaccine works.
With everything that you and your family have been through, you guys have that personal experience now. And as a lawmaker, as one of our state's leaders, how do you feel about how Utahns are working through the pandemic?
I think that people are really trying their best, and we haven't done this as a society. It's been a century since the last real serious pandemic. And I think that we need to maybe be a little bit more patient with each other and just know that people respond in different ways. And sometimes there's not a right way or a wrong way. The good news is we're now fourth in the nation for getting our vaccines out. And I just, heard the governor say that hopefully by July 4th, life is pretty much back to normal and maybe we can burn our masks. Obviously, we'll wait until, the data shows that it's safe to let our guard down. But I'm extremely optimistic that we're heading in the right direction. Case counts are coming down, and that, the pandemic has just showed that, Utah can pull together during times of crisis. We can watch out for one another, and we can get through this together.
Now, there are a number of reasons why Utahns should consider getting the vaccine. It protects their families, such as it protected yours, allowed you to care for them in the time of need. It would slow the spread of COVID in the community, and it would help get the economy back on track. Would you say that these are American values? Is this something that people should think about when they're grappling with the decision to get the vaccine?
You know, the decision to get the vaccine is a personal choice, and I don't think the government should, be mandating that for the citizens at all. But I think that when people see that now that it's been out for a number of months, and there's not, the scary side effects that some people, feared with a rapidly developed vaccine, that our case counts are coming down as the vaccine counts are going up. Our hospital counts are going down. Our ICU counts are going down, and we'll see that death number continue to go down as infections and hospitalization rates go down. So, for me, I think that those are American values from my perspective, and I'm glad that I can play a part in protecting myself, my family, and to a degree, society as a whole to help us get back to normal, because that's really what we all yearn for. And I think that it's kind of like when there's a natural disaster or a wartime effort, certain people kind of rise up and do their part. And I think I hope in some small way my participation in the vaccine trial was my attempt to do that.
Representative Eliason, we appreciate your time so much. Thank you for being a part of our discussion tonight.
Thank you, Rosie.
We're seeing that the local health departments are vaccinating at a rapid pace. So I think that's what you could really contribute it to.
That was Rich Lakin, the immunization program manager for the Utah Department of Health back in January, talking about the work the health department had been doing statewide. Thanks for staying with us for our second In Focus discussion tonight. Developing the vaccine and making sure it is effective is only one part of the plan to get us through the pandemic. More than 3 million people in Utah need to get vaccinated. Earlier today, we talked to Rich Lakin, the immunization program manager for the Utah Department of Health. Since people 65 and older can now sign up for the vaccine, we started by asking him about how they're gearing up for the increase in people needing vaccines.
Basically, what we're doing is as we open up more populations, more age groups, so the state of Utah is in an age-based system. And our current capacity right now, we won't meet that capacity as we continue to open up more age groups, and with the anticipation that we're going to receive more vaccine. So what are we doing to increase our administration capacity? We're actually bringing on partners. We're bringing on Intermountain Healthcare to have 7 sites. We're bringing on NOMI, which is a contractor, and they'll have several sites across the whole state. We're bringing on University of Utah Community Nursing Services. And then also there's the Federal Retail Pharmacy Partnership that is working with Kroger Foods, so like Smith's and Walmart and Albertsons and a few others. And then we are working as a state with Associated Foods to get vaccine to them. So as you can see, we're just really expanding our capacity through mass vaccination sites, using additional partners that I had just mentioned, and then also pharmacies for easy accessibility for people that are used to going to their pharmacy.
Governor Cox said he wanted demand to outweigh supply of the vaccine. Why is that important?
What that means is that we can continue to vaccinate at a pretty quick pace. And eventually, when we get to April, we're anticipating that there could be 400,000 doses per week in the state, and then we want to ensure that our partners are ready to do that. And we never want to have so much vaccine in the state that, and there just isn't enough demand for it. So Governor Cox is right in that statement, where as long as the demand is high, we can continue to get all of these people vaccinated as quickly as possible.
What does it mean that more brands of the vaccine, such as the singular dose shot from Johnson & Johnson, are coming to the market? Will Utahns have a choice in which vaccine they get? And is the state health department planning for that?
So there will be more availability. Like I said, we're bringing on all these partners so that people within the state of Utah can have a number of options. They can go to mass clinic sites, they can go to the local pharmacy. Eventually, they could perhaps go to their physician, they could go to clinics. So we're really trying to increase our availability for anybody that would like to go. In regards to the vaccines, Pfizer and Moderna, and Johnson and Johnson, these vaccines will be spread out all across the state of Utah, and most of the vaccine will be Pfizer and Moderna, but eventually Johnson & Johnson will come on, and those will most likely be places where it's easier, kind of where that vaccine can be administered. So perhaps like congregate setting, homebound, homeless people, because we don't anticipate that it would be easy for them to come back for a second dose. And Johnson & Johnson is a great a vaccine for those populations.
The state health department seems to be on track to vaccinating every adult who wants one by August. What are the next steps to make that happen?
So our plan to get everybody vaccinated actually has moved up to about June that would want it. So anybody above 18 and older would have an opportunity to get receive the vaccine, hopefully by June. And in order for us to reach that, all the things that I had just mentioned, all of our partners such as NOMI, Intermountain, University of Utah, pharmacies, every bit of vaccine that we receive in the state of Utah needs to be allocated out so that it can be put in arms as quickly as possible. And that is our goal, is really speed, getting that vaccine into arms as quickly as possible. So that's kind of what we're working on. I think like I had mentioned, our time frame has moved up. We had anticipated that probably August or September would have been what we would have thought to reach every Utahn that would like to receive the vaccine. But we will be ahead of that schedule, and we're hoping that by June.
Rich, thank you for taking the time to be part of our discussion tonight. We appreciate your time.
I appreciate the opportunity, and any time that we can help citizens of Utah understand it clearly more through the opportunities of media to get it out there, we really appreciate it.
Masking and physical distancing and better hand washing, we've known for years can control flu, but now we're doing this natural experiment where we're controlling it really dramatically.
That was Dr. Andrew Pavia yesterday talking about the unexpected benefits of the measures we've taken to prevent the spread of COVID-19. Welcome to our third and final In Focus discussion tonight on the latest on the COVID-19 vaccines. Joining us now is a person you just heard from, Dr. Andrew Pavia, Chief of Pediatric Infectious Disease at the University of Utah. Dr. Pavia, thank you as always for your time and welcome back to the show.
Well, thanks for having me. It's great to be able to talk to people about this subject.
Dr. Pavia, let's talk about how the new positive case counts have been steadily dropping in our state. What are some of the contributing factors to this?
Well, it's great news that they're going down, and it's almost certainly multifactorial, but anybody who tells you they know exactly why is full of it. We think there are a number of factors. There are continued good behaviors with better mask use and better social distancing. We've learned how to do that. There are pockets where there are a lot of people who have been infected already, and they are not spreading it within those pockets. So some groups have a high level of immunity, but we're also kind of not behaving very well and spreading it rapidly. And then there's an effect that's just beginning to come online from vaccines. But we're seeing this dramatic effect around the country. And we're not entirely sure that we know which factor contributed most.
What's the biggest issue we're facing right now when it comes to the vaccine? Is it the supply?
It really is. Initially it was the ability to deliver vaccine. In Utah, we've done a pretty good job of ramping that up, and it's getting better and better. So now we just need to get enough vaccine to the vaccinators so we can quickly vaccinate everybody who wants it and everyone who needs it, which should be just about everybody.
Now, some of the online chatter about the vaccines is skewed to how it's not effective or less effective against the variant. So let's set the record straight. How effective are the vaccines, and how might the variants change things?
Well, without spending too much time about the individual variants, they sort of come in two flavors. One flavor is the UK variant, which spreads much more easily, may be a little bit more dangerous. What that does, but the vaccines work pretty well against that variant. But what that means is that if we don't get vaccine out to people and continue masking and social distancing, what'll happen to us, what's happened to other countries where this variant has started to spread very rapidly, and we'll see another big surge. The other flavor of variant are variants like the ones identified in Brazil and South Africa that are more resistant to the vaccines and more likely to infect people who've been infected with the older variety of the SARS-CoV virus. And so what that means is that unless we have really knocked transmission down very low, that these may pose a threat even to people who are vaccinated. Now, having said that, it looks like the vaccines do provide a pretty good level of protection even against those variants, but it's not as good as it was against the original virus.
Johnson & Johnson is close to having their one-shot vaccine available. What do we know about that vaccine, maybe as far as how effective it is, and what does it mean for getting the virus under control?
We only have preliminary data that was released by press release about a month ago. Within the next 12 hours, we're going to see, or I expect to be able to see the final results, and the FDA is going to review that on Friday. And this is a pretty exciting vaccine. It was a little bit less effective against all symptomatic disease compared to the two-shot vaccine, mRNA vaccines, but it's a single shot, it's easy to handle, and it was equally effective against severe disease and hospitalization. So we're really excited to get this vaccine to improve our ability to get it to basically to everyone and to get it to people for whom coming in for two shots is going to be a real problem, as well as coming to a place where we can handle the storage requirements of the Pfizer vaccine, which are pretty daunting. You know, not every doctor's office can handle having that vaccine. It's just too difficult to handle safely or effectively.
Dr. Pavia, this next question is one that I've been asked several times. Can vaccinated people still carry the virus and be spreaders?
For many vaccines, they do not fully prevent you from getting asymptomatic infection in which you get infected, you have no symptoms, and you can pass it on. We only have preliminary information for SARS-CoV, and the information we have suggests that vaccine provides some protection, maybe even decent protection against asymptomatic infection, but it's nowhere near 80 to 95% from what we know so far. So yes, vaccinated people, at least to some degree, can get infected and can probably pass it on. And what that means is that while there's still a lot of virus in the community, vaccinated people still have to mask to prevent bringing the virus home to a loved one who's not vaccinated yet. Eventually, when we get it down to where we're having 10 or 20 or 50 cases a day for the entire state, things will be very, very different. We're still averaging almost 800 cases a day, and we've got to get that down a lot farther.
Dr. Pavia, about 30 seconds left. I want to know about children. When do you think we'll have a vaccine available for children, and how important is it that they get vaccinated?
Well, there's good news and bad news. We should have vaccine approved for teenagers probably by summer. And that's a really important group to vaccinate because they spread the disease, and although it's not very common, we've taken care of a lot of very, very, very sick teenagers with the disease. It's going to take another 6 to 8 months after that before we get vaccine for the younger children. But they're the group I'm least worried about in terms of needing to have vaccine early on. It's really important that we get the data that says it's safe to vaccinate teenagers and that we start doing it.
All right, you've been hearing from Dr. Andrew Pavia, Director of Pediatric Infectious Diseases at the University of Utah. Dr. Pavia, thank you so much for updating us on where we are with the vaccines. We always appreciate your time.
Well, thank you, and stay safe and keep wearing your mask for at least a couple more months.